Welcome to WGU Prep YouTube channel. Access all practice questions. Advanced Nursing Skills. Practice questions with answers. Question 1. Which is the most important step before performing a central venous catheter insertion? A. Aseptic technique. B. Confirm patient ID. C. Verify lab results. D. Administer sedative. Which one is the correct answer? The correct answer is A. Aseptic technique. Explanation. The most crucial step is ensuring aseptic technique to minimize the risk of infection during the procedure. Question 2. What is the first action when a patient experiences an anaphylactic reaction? A. Inject epinephrine. B. Administer antihistamines. C. Call emergency services. D. Apply cold compress. Which one is the correct answer? The correct answer is A. Inject epinephrine. Explanation. Injecting epinephrine immediately is the first action in treating anaphylaxis to reverse symptoms and prevent shock. Question 3. What is the correct method for assessing a patient's Glasgow Coma Scale, GCS score? A. Verbal, motor, eye response. B. Assessing pupil reflex. C. Monitoring vital signs. D. Checking for reflexes. Which one is the correct answer? The correct answer is A. Verbal, motor, eye response. Explanation. The Glasgow Coma Scale assesses a patient's responsiveness by evaluating their eye, verbal, and motor responses. The correct answer is, which action should be taken immediately following an accidental needle stick injury? A. Clean the wound. B. Report to supervisor. C. Administer tetanus shot. D. Apply pressure. Which one is the correct answer? The correct answer is A. Clean the wound. Explanation. Cleaning the wound thoroughly with soap and water, followed by reporting the injury, is essential to minimize infection risk. Question 5. Which of the following is the priority when managing a patient in septic shock? A. Administer antibiotics. B. Increase fluid intake. C. Monitor blood pressure. D. Administer oxygen. Which one is the correct answer? The correct answer is A. Administer antibiotics. Explanation. The priority in septic shock is administering antibiotics quickly to target the infection and prevent further complications. Question 6. Which of the following is a common complication after a coronary artery bypass graft, CABG? A. Infection at the incision site. B. Deep vein thrombosis. C. Respiratory distress. D. Stroke. Which one is the correct answer? The correct answer is A. Infection at the incision site. Explanation. Infection at the surgical site is a common complication after CABG surgery, requiring vigilant monitoring and care. Question 7. Which technique is used to reduce the risk of aspiration in an unconscious patient? A. Semi-Fowler's position. B. Prone positioning. C. Lying flat. D. Elevating legs. Which one is the correct answer? The correct answer is A. Semi-Fowler's position. Explanation. The semi-Fowler's position, where the head of the bed is elevated, helps prevent aspiration by facilitating easier airway management. Question 8. What should a nurse do first when a patient is experiencing chest pain and shortness of breath? A. Give oxygen. B. Administer aspirin. C. Notify the physician. D. Perform an ECG. Which one is the correct answer? The correct answer is A. Give oxygen. Explanation. Administering oxygen is a priority in cases of chest pain to ensure adequate oxygen supply to the heart and reduce strain. Question 9. What is the first step in performing a sterile dressing change? A. Prepare sterile supplies. B. Cleanse the wound. C. Remove the old dressing. D. Assess the wound. Which one is the correct answer? The correct answer is A. Prepare sterile supplies. Explanation. Preparing sterile supplies ensures that the dressing change process is done in a sterile manner to prevent infection. Question 10. Which of the following is the best intervention to prevent catheter-associated urinary tract infections, CAUTI? A. Maintain strict aseptic technique. B. Regular catheter changes. C. Keep the catheter above bladder. D. Restrict fluid intake. Which one is the correct answer? The correct answer is A. Maintain strict aseptic technique. Explanation. Maintaining strict aseptic technique during insertion and care of the catheter is the most effective way to prevent infection. Thank you for watching. For more practice questions, subscribe to our website at WGUPracticeQuestions.com.